As far as the long-term outlook in these patients, they do very well if they are diagnosed correctly and treated long enough. Because if the patient's treatment is started correctly but then stopped too soon, like less than 6 months if it's stopped, then the disease comes right back. The other thing in these patients is that for every 100 people that have this disease, about 15 will have some vision loss, and it usually is a permanent vision loss. The other rare thing that can happen in these patients is the aorta, as it's coming out of the heart and kind of going down the body, it can have what's called an aortic dissection, which means that the lining of the pipe or the blood vessel, the aorta, can separate from the wall itself and make the aorta a little bit weak. In these patients, they can get more heart attacks and more strokes, but not because of the disease itself, but because of the blood vessel is now inflamed and swollen, and blood vessels are a little bit narrow in general. And then finally, again, a very rare thing, sometimes thoracic aneurysms can happen, which means as the aorta is going down the thoracic cavity, again, because of these skip lesions, so some parts of the aorta are strong and some parts aren't, then the parts that are weak can actually pooch out or can balloon out, and that's called an aneurysm. Now, I know this is a very scary diagnosis for some patients, and especially the medications, they are started so quickly and they can be very, very overwhelming. But it is all done to prevent permanent damage. So, as the ancient physician Hippocrates would say, extreme remedies are very appropriate for extreme diseases.